I think that ingrained in the Cuban culture is espresso coffee, black beans, rice, pork, and salsa dancing.
My name is Anna. I came from Cuba. Before I turned 12, I hit puberty. As I was developing, so were my breasts, and they weren't symmetrical. When I turned 18, it was quite noticeable. So I got teased. It was hurtful. I felt different. I felt no one knew what I was going through. No one had or seemed to have this problem. No one was an A to a C cup. It was something that I felt that I was alone in and no one can understand. So instead of being in the water, I kind of laid back by the sand and I watched everyone else because I didn't want to be looked at like, this freak.
Anna's brother, Jose, who works down the hallway, called me and said, Nora, I'd like for Anna to come and visit Dr. Polo and consult regarding a lack of symmetry that she has to her breast. So I introduced them to Dr. Polo, I gathered all the information, and then I created a quote. To her great disappointment, it far exceeded what she could do financially. It sat with me. It just didn't leave me. And so even though I had worked with Dr. Polo for a very short time, I went to him and I said, I have a favor to ask you. I would like for you to do the procedure for Anna at no cost to her. And to my amazement, he simply said, okay.
She had a significant hypoplasia of one breast. I mean, when you see a case like that as a surgeon, you want to do that case, no matter what. It's because you know it's going to have a great impact on that patient's life, and that's why you got into this. Okay?
So many people came together to make it happen. It was Dr. Polo, it was Mentor, it was the anesthetist, it was the nurse and the young ladies that assisted Dr. Polo. Everyone came together to make this happen for her.
Mentor had a very important role in this case. We ended up performing 2 procedures for this reconstruction, a tissue expander and 2 silicone implants, so there's a large expense. So we went to them first for assistance, and they've always been very receptive in cases like this.
When I first showed up for the surgery, I was afraid. I thought that I was going to walk back out instead of in. They all did a pretty good job at keeping me calm, though.
She did very well. She seemed to really become excited about things as she saw the result from that first procedure. And then it seemed like no time at all before we were going back for the second and completing things.
This is similar to the silicone implant that I have inside of both of my breasts. They feel actually really nice inside. And to me it feels quite real. It doesn't feel unnatural or fake or anything. I can actually wear the clothes I want to wear, dress the way I want to dress. I can finally be comfortable in my own skin. Being normal feels nice.
I know that it's made a significant difference in the quality of her life. Life is easier. She fits in, she has more confidence, and she's very immersed in her Cuban culture, as well as her brother Jose, and they dance together. When Anna's on the dance floor, she's a confident young lady.